As the popularity of youth ice hockey has grown in recent years, the injuries associated with it have grown as well. I'm Erin White with your latest health news. The American Academy of Pediatrics wrote that one of the most important ways to reduce injury risk was to expand programs to prevent body checking in the sport. Body checking is deliberately obstructing an opponent by putting one's body in their way. Dr. Michael Ishitani, a pediatric surgeon at the Mayo Clinic Children's Center, says due to the fast, hard-hitting nature of the game, people often ask what kinds of injuries might happen to my children.
The most common type of injuries were fractures, which may require splinting, casting, or even an operation to treat. The next most common type of injury was traumatic brain injuries, or more commonly known as concussions.
Speak with your child's coach about safety rules in their sport.
Allergies is an immune system disorder that occurs when the immune system is overly sensitive to certain non-disease-causing substances called allergens. Allergies can be described as a false alarm of the immune system. Allergies can cause a variety of minor symptoms, including runny nose, itching, swelling, or sneezing. However, some severe allergies can cause hives, trigger asthma attacks, or create life-threatening breathing problems. Some common allergens include pollen, pet dander, insect stings, certain food, and certain medication. Family history of allergies, a lack of early childhood exposure to allergens, and young age may increase the risk of developing allergies. Treatments include many over-the-counter antihistamines, including cetirizine, fexofenadine, and loratadine. Prescription steroids, including prednisone and methylprednisolone, have also been used to treat severe allergies. Allergy shots, also known as desensitization therapy, is often effective at preventing allergies. The easiest way to prevent allergies is to simply avoid the offending allergen. Wash hands and clothes thoroughly after touching a known allergen. Know and avoid drug and food allergies and exercise caution whenever there is a chance you may be exposed to serious allergy triggers.
Women typically go through menopause in their early 50s. However, could hitting menopause at an earlier age reap serious health risks? I'm Sonia Singh with your latest health news. A recent study found that women who went through early natural menopause between ages 40 and 45 were at an increased risk for heart failure, more so than women who went through menopause in their 50s. Researchers found that smoking tobacco increased the risk of heart failure for women who went through early menopause, as well as those who went through menopause at ages 46 to 49. Speak with your doctor to gain more insight into the risks associated with early menopause.
Many cancers are not detected until it's too late, but there are some early signs of cancer that women might overlook. Knowing the symptoms to look for can help a doctor diagnose cancer early, which can boost the odds of successful treatment. I'm Erin White, and this is a health feature. The early signs of cancer in women can often be attributed to more common illnesses, but any unusual symptom that lasts for more than 2 weeks should be reported to a doctor, who can diagnose and treat the problem. Unusual bleeding, even if it goes away quickly, should be seen by a doctor, especially if you're older. It could signal leukemia, colorectal cancer, uterine cancer, or cervical cancer. Swollen lymph nodes or lumps around the neck, underarm, or groin should be examined by a doctor, as these are often signs that the body is fighting an infection. This could point to leukemia or breast cancer. Pelvic or abdominal pain, bloating and feeling full when the discomfort isn't part of your monthly menstruation cycle or lasts for more than a few days may be a sign of ovarian cancer. Shortness of breath, wheezing, a bad cough or chest pain, difficulty swallowing, or a long-lasting feeling that you need to clear your throat could be signs of lung cancer, lung tumors, leukemia, esophageal, or throat cancer. Gut troubles such as a sudden drop in weight with no changes to diet or exercise, chronic upset stomach, cramps, or stomach ache may be signs of colon, pancreatic, or liver cancers. Skin changes or dark streaks or dots in fingernails and toenails, as well as nail cracks, could be symptoms of skin cancer. Additionally, fevers that last for long periods or reoccur may be leukemia. Listen to your body and know when to alert a doctor about any unusual symptoms.
Diabetes is a condition where blood sugar levels remain higher than normal. There are two main types of diabetes. In type 1 diabetes, the body attacks cells that normally produce insulin. In type 2 diabetes, the body does not make or use insulin the way it should. Insulin is a hormone that helps the body use sugar for energy. In diabetes, problems with insulin causes sugar to stay in the blood. Another form of diabetes that mainly affects pregnant women is known as gestational diabetes. Symptoms of diabetes include increased thirst, frequent urination, fatigue, blurred vision, frequent infections. Age, family history, race, diet, and lack of exercise may increase the risk of developing diabetes. Over time, having too much glucose in the blood can cause damage to the eyes, kidneys, and nerves. Diabetes is also a risk factor for many other conditions, including infection, heart disease, and liver problems. There are many different medications that can help treat diabetes. Oral anti-diabetic medications like metformin and glipizide are effective in keeping blood sugars in check, and injectable insulins are often used to help the body use blood sugars normally again. Eating a healthy diet, maintaining a healthy weight, and exercising can help control diabetes. It's important for diabetics to routinely check their blood sugars, take medications on time, and get regular checkups to watch out for complications.
Women who have pregnancy complications may feel relieved when a healthy delivery is in the past, but if you had high blood pressure during pregnancy, you may want to let your post-pregnancy physician know. I'm Jennifer Dodd, and this is a Daily RX Minute. A recent study found that women who had pregnancy complications related to high blood pressure were more likely to have risk factors related to heart disease and diabetes a few years after giving birth than women who didn't have high blood pressure during pregnancy. Tell your primary care doctor if you had preeclampsia. For Daily RX TV, I'm Jennifer Dodd.
When it comes to fiber, many people may not know the truly important benefits that come along with this particular nutrient. However, your body may thank you immensely. I'm Sonia Singh, and this is a health feature. Fiber, also known as roughage, scrubs the colon, eases bowel movements, and helps to fend off constipation. Now, fiber not only makes you feel better day to day, but can also have long-term benefits, such as helping to prevent certain kinds of cancers. So what foods can we consume to up our fiber intake? Vegetables, beans, whole grains, and fruits are all rich in fiber. In fact, the U.S. Department of Agriculture recommends that veggies and fruits take up half the space on your plate. Be sure to read the labels on canned, boxed, and other packaged goods when you're at the grocery store next, and choose the foods highest in fiber. Your body will surely thank you. And speak with your doctor if you have any questions regarding fiber intake.
By translating health information into a consistent, easy-to-understand language, the Daily RX News Network enables you to take control of your health. Sign up for the Daily RX newsletter to receive the latest health news and videos right to your inbox every morning. For trusted, research-based health news, join us at dailyrx.com. Your health starts here.
Chronic pain disorders form a family of conditions where patients suffer from pain that can last for weeks, months, or even years. Chronic pain disorders have a variety of possible causes, including injury, infection, cancer, and nerve problems. Sometimes chronic pain has no clear cause or may be the result of multiple causes. Strenuous physical activity, a history of serious injury, mental health issues, and many other factors can increase the risk for chronic pain. Managing chronic pain often requires time and multiple checkups to develop an effective treatment plan. Luckily, treatments are geared towards decreasing pain and how often pain occurs, and this can help limit symptoms. Medications such as pain relievers, antidepressants, and anticonvulsants are often effective at relieving different kinds of pain. Other treatments include physical therapy, psychotherapy, and behavior modification. In some cases, surgery or other major treatment options may be needed to address the cause of pain. Living with chronic pain can often become a challenge. Do not get discouraged if treatment does not work. As well as initially, many chronic pain disorders are treated gradually or may require changes to your treatment over time. Work with your healthcare providers to make sure your treatment plan is working for you.
Cancer diagnosis and treatment has come a long way in recent years, with many patients beating their cancer. However, early detection is often key to survival. I'm Kendra Rowland, and this is a health feature. Breast cancer, the most common non-skin cancer among women, is very treatable when detected early. Patients diagnosed while the cancer is still in localized form have a significantly higher 5-year survival rate than those detected at a later stage. Skin cancer is the most common form of cancer, and if found early is nearly 100% treatable. Prostate cancer is among the most common cancers in men, but if detected before it spreads beyond the prostate gland, is also highly survivable. Colon cancer is the second most common cancerous killer because it is often not detected early. With early detection through colonoscopy, colon cancer has high survival rates. Testicular cancer is most common in young men aged 15 to 45, and doctors recommend performing regular self-tests for early detection. Cervical cancer, often caused by HPV, can be detected early with a Pap test. All of these cancer forms are treatable and survivable through early detection. Speak with your doctor about proper cancer screenings.
Parents want to keep their children safe and healthy. So Dr. Ari Brown reminds her patients that vaccines are important, safe, and effective.
The truth is that vaccines are very safe and vaccines do their job. And the diseases that they are protecting against are quite real.
That's why doctors of the Texas Medical Association started the Be Wise Immunize program. They've given more than 100,000 free or low-cost shots to Texas children.
Vaccines have been one of the most important ways that we've been able to prevent serious illness and death in children.
Texas Medical Association, improving the health of all Texans.
Lice are parasitic insects that can sometimes be found on the heads and bodies of certain patients. Lice can cause intense itching and small red bumps on the scalp, neck, and shoulders. In addition, lice eggs or crawling lice may be visible in the hair or on the skin. There are 3 common forms of lice, including head lice, body lice, and pubic lice, sometimes known as crabs. Lice are easily spread through close personal contact and by sharing belongings with people who have lice. Even though lice most typically affect school children, lice can affect people of all ages. Lice are not spread by pets, nor can they hop or fly to new hosts. Both over-the-counter and prescription medications are available to treat cases of lice. Over-the-counter medications like Nix and Rid are available as shampoos, lotions, and rinses. Prescription medication, including Sklice, is available as well for cases that are hard to treat. Keep people with lice away from others until they can be properly treated. Maintain proper hygiene to avoid lice. Always remember to wash all clothes and bed sheets with hot water and detergent if you find someone close to you has had lice, as lice can sometimes survive on household items for long periods of time.